And our next case is totally dedicated to the critical infrastructure recovery. You will see different approaches from emergency responses to large-scale projects in water, sanitation, and hygiene. The speakers are Matthew Stearns, Ukraine Country Director in International Medical Corps, and Marina Baydakova, representative of Marganets City Council. Matthew, Marina, the floor is yours.
Hi, everybody. Greetings. My name's Matthew Stearns. I'm the Country Director for International Medical Corps, Ukraine. We're primarily a humanitarian organization, and we've been in Ukraine since 1999. We focus on emergency healthcare interventions. That includes mental health care, gender-based violence interventions, and as I'm going to talk about today, really important critical infrastructure programs targeting water, hygiene, and sanitation elements in Ukraine that have been devastated by. Marina, thank you for joining. I'm going to go through my remarks now, just to get you oriented in terms of the work that we've done in cooperation with folks like Marina at local level, and give you a picture of what's the situation in terms of water, sanitation and hygiene in Ukraine, and what we can accomplish here together. And first, I just want to thank everyone for attending. There's a lot of energy in this conference, and that energy translates to commitment to be supportive in Ukraine, and I want to thank everybody for attending in that regard. So, the full-scale invasion in Ukraine has been devastating on so many levels. Tens of thousands of civilians have been killed and injured. Millions of Ukrainians have been forced to flee the country. Millions more, sorry? Closer, okay. My manager tells me I have to speak closer to the microphone. Thank you. Millions more are displaced inside the country. Ukraine's critical infrastructure has been targeted and attacked regularly. This includes hospitals, clinics, schools, apartment buildings, businesses, and water supply facilities, and power plants. Power cuts and electricity shortages have become the new normal in Ukraine. Every aspect of daily life for Ukrainians is affected. The targeted attacks have resulted in extensive damage to Ukraine's water supply infrastructure and to sanitation, irrigation, and ecosystems. The World Bank reports that the destruction of the Kakhovka Dam last year meant that around 1 million people in southern Ukraine lost access to drinking water. Millions of people in other parts of the country are also coping with unreliable and inadequate water supply and sanitation services. I realize that I have a presentation, I think, prepared. Let me move forward here. So we're talking about impacts, right? The Water Sanitation and Hygiene Cluster, this is otherwise known as the WASH Cluster. It's an organizing body that helps us figure out what needs are there and organizes actors like us to go into areas that need assistance and help them. The WASH Cluster estimates that 9.6 million Ukrainians are lacking essential water supply and sanitation services this year. Damage to the water and sanitation sectors has been calculated at almost $4 billion US. Total cost of reconstruction and recovery between 2024 and 2033 is estimated at $11.1 billion. International Medical Corps' response since the full-scale invasion covered a wide range of activities like I mentioned, health and mental health and gender-based violence intervention. We concentrate a lot on water, sanitation, and hygiene efforts as well. Our immediate response to the attacks includes distribution of bottled water and hygiene kits. We're also concentrating on rehabilitation of water and sanitation services and drilling of boreholes to provide alternative water sources to local populations that don't have access to clean water. In the second year of the war, International Medical Corps' WASH team adopted a more hybrid approach to its crisis response. We continue to distribute bottled water and hygiene kits in areas close to the front lines. But we also operate mobile water treatment units and a cash for hygiene program in areas of the country that were relatively more stable than where markets are still functioning. Both water treatment units and cash for hygiene programs were successful, and we're going to use these models to structure further interventions along the same lines in these frontline areas that have been impacted by this war. This year, International Medical Corps, we're celebrating our 40th anniversary of responding to crises around the world. We first came to Ukraine in 1999. We opened an office in Mariupol in 2014 in response to the fighting and needs in that southeastern part of the country. We were here in the start of the invasion. We scaled up our operations and built up to more than 400 staff across the country. So our commitment is significant and our experience is significant. And our successes in the work that we've done in this sector are based on our best practices. Practices like inclusion. We implement our rehabilitation projects with the principle of inclusion in mind. This includes helping to make health facilities accessible to people with disabilities through the installation of ramps and renovation of washrooms. We also distribute items such as bottled water door to door for people with with mobility challenges. Improved capacity is another principle that we abide by. International Medical Corps and our WASH and infrastructure team in Ukraine have built up capacity to implement major construction projects. These include drilling boreholes and installing water treatment systems, as well as refurbishing bomb shelters. Coordination, another principle that we abide by. International Medical Corps has been serving as co-lead of the WASH cluster in the southeastern part of Ukraine. Adaptation to the context. We align our priorities with the Ukrainian government's long-term plans, with a focus on building toward European Union standards in areas like reconstruction and modernization. Our focus on restoration of water supply systems. Our WASH teams take the challenge of restoring these systems in participatory and sustainable ways. We work with local communities and people like Marina to play an active role in these projects. Marina's here from Marhanets in southeastern Ukraine. She's the head of laboratory responsible for the city's water supply and member of the executive committee of the Marhanets City Council. We've worked closely with the local authorities and institutions there, and one of our mobile water treatment units is operating there. Through this participatory approach, International Medical Corps has been able to provide more than 2,370,000 liters of drinking water to over 50 communities in some of the worst affected parts of eastern and southern Ukraine. Our WASH team's approach has also evolved over the course of the war. They began by providing clean drinking water to people by distributing 1.5 liter bottles of water. Then, to reduce waste and protect the environment, we switched to 6 liter bottles that could be reused. The WASH team also gave out hygiene kits to Ukrainians in need and infection prevention and control kits to healthcare facilities. We then introduced the mobile water treatment units to treat surface water or water from boreholes and wells to make sure that water was safe. They're capable of treating up to 2,000 liters of drinking water per hour. Larger scale projects followed. These have included boreholes for hospitals, such as in the Odessa Central Regional Hospital. And we're planning more sustainability projects, including giving tools for communities in operating maintenance of their water supply systems. An important and related aspect of International Medical Corps' humanitarian response to the Ukraine crisis has been extensive infrastructure work carried out on damaged healthcare facilities around the country. 2,000 hospitals and health clinics have been damaged in this war, and more than 200 have been completely destroyed. We support 400 health facilities in a variety of ways, and we've implemented infrastructure work at more than 80 of them. This work ranges from simple replacement of damaged windows to the refurbishment of hospital bomb shelters and installation of ventilation and heating systems. Earlier this year, we marked the completion of major projects at 3 important hospitals in southern Ukraine: Central Regional Hospital and Maternity Hospital No. 5 in Odessa, Bashtanka Multidisciplinary Regional Hospital in Mykolaiv. Our work continues. We're obviously committed. We've been committed to stay in Ukraine since 1999. The full-scale invasion resulted in a whole-of-agency commitment to response in Ukraine. The generosity of our donors and the cooperation of the host government, we've had a lot of success in getting emergency needs to people across Ukraine, especially in those frontline areas. Our aim is to provide a multi-sectoral integrated healthcare response in Ukraine that supports populations and civil institutions in early recovery settings, while building and preparing capacities for transition to local ownership. So this localization piece is very important to us. We want to empower and enable Ukrainians to be able to implement these types of projects on their own, and we're patient and willing to do that in the long haul. So through this integrated approach, we contribute to the health and well-being of war-affected populations, including the millions of internally displaced persons and communities that host them. I'm really proud of the work that we do there. I'm proud of our collaboration with people like Marina. I want to introduce her now. She's got some remarks as well. Let me do another formal kind of introduction here just to give her full credentials. So Marina is the head of HBL Laboratory. It's responsible for the water supply system in a place called Marhanets. She's also a member of the executive committee of Marhanets City Council. So thank you for hearing me out, and please welcome Marina with her remarks. She'll share some comments with you as well. Thank you so much.
Пані Марино, ми трохи затримали таймінг.
We stopped the time a little bit, so I would be grateful if you could be concise, please. Hello, I represent the Marganets local community in the Dnipropetrovsk region. My community is 5 kilometers away from Enerhodar that has been occupied by the Russians, and from the Zaporizhzhia nuclear power plant we're being shelled by the Russian occupying forces every single day. The Russians have damaged and keep on destroying our infrastructure, hospitals and circles. We provide water to our neighboring communities, to neighboring communities. And once the Kharkovka Dam was exploded, most of the communities in our region have been left without any water supplies. And then our country decided to develop a project on supplying water from the Zaporizhzhia to Marganets, Pokrovsk and to Kryvyi Rih. And for the time of the implementation of this project, and given that no water supply was possible for a long period of time, we started cooperating with the management of the Dnipropetrovsk region, and we started cooperation with central authorities and with donors, and we were capable over a span of 1.5 months to run a number of projects on providing the community with technical water, but also we started providing potable water to the population. As for the technical water, we were compelled to supply water with a high content of salt, and it was really hard water. And this type of quality was provided for the whole year. But that has led to the deterioration of the technical condition of our water mains. And the total length of our water mains is 700 kilometers. But as for now, almost 80% of our water mains need to be replaced. Our community will not be capable of doing this type of magnitude of work, as this work is quite expensive, but this has been made possible, rendered possible due to our international partners with whom we have positive experience of work. And we started working with the International Medical Corps, and we started working with them on a number of projects. So, for instance, with granulars for purifying the water or providing potable water to the mobile water points. We also established the reverse osmotic wastewater treatment plant, and we have been able to provide many places with good quality potable water. Also, we started providing water to our healthcare facilities and provided them with water, but also with hygienic means. We're also training our medical staff. We are very grateful to this partnership with the International Medical Corps, and our next common project is replacing some of the water mains sections, and this work is due to commence very soon. Thank you very much for your kind attention. Thank you, Marina.
Totally out of schedule. We have no time for questions to our speakers, so if you have some, you can ask them privately. Thank you very much, Matthew. Thank you, Marina.